Ever wondered how where you live impacts your health? Welcome to Class Bites. Today, we're diving into the fascinating world of health geography, exploring the intricate link between our environment and our well-being. The world we inhabit is more than just a backdrop for our lives. It is an active participant, shaping our health in ways both subtle and profound. The air we breathe, the water we drink, and the communities we build are all threads in the intricate tapestry of our well-being. To understand this deep connection between place and health is the purpose of a fascinating field known as health geography. It is the art and science of applying geographical information, perspectives, and methods to the study of health, disease, and the systems of care we rely upon. At its heart, it is a story of human-environment interaction, exploring how the places we live influence the quality of our lives and our vulnerability to illness. This discipline, sometimes called medical geography, essentially follows two distinct but interwoven paths of inquiry. The first path is a journey into the spatial distribution of sickness and death. It seeks to understand not just what makes people ill, but where they become ill, and why those particular locations foster disease. This branch, often described as disease geography or geographical epidemiology, is a kind of detective work on a grand scale. It moves beyond the traditional study of epidemics by incorporating the unique tools of geography, allowing for a more ecological perspective. It considers the complex interplay between people and their surroundings, the climate, the landscape, the built environment, to explain why certain health outcomes are observed in specific places. It is a field that asks why one neighborhood might suffer from a particular ailment while another, just a short distance away, remains untouched. A famous historical example illustrates this power of place-based investigation perfectly. Long ago, in a bustling London neighborhood, a terrifying outbreak of cholera struck down residents with alarming speed. The prevailing belief at the time was that the disease was airborne, a mysterious vapor that drifted through the streets. A physician named John Snow, however, suspected something else. Instead of just treating the sick, he began to map them. He marked each case on a city plan, and as he did, a startling pattern emerged. The deaths were not randomly scattered, but clustered intensely around a single public water pump on Broad Street. His map told a story that medical science alone could not. It pointed directly to a contaminated water source as the true culprit. By viewing the epidemic through a geographical lens, he was able to identify the source and counter a deadly disease, changing our understanding of public health forever. The second path of inquiry within health geography turns its focus from the patterns of disease to the systems we create to combat it. This area of study is concerned with the geography of healthcare itself, the planning, provision, and accessibility of medical services. It examines the spatial organization of our health systems, asking critical questions about the location of hospitals, clinics, and other resources. It explores how the arrangement of these facilities affects people's ability to seek and receive help. A state-of-the-art hospital is of little use to a community that cannot reach it due to distance, lack of transportation, or other physical barriers. This branch of the field analyzes help-seeking behavior and strives to ensure that the distribution of health services is equitable and effective, reaching those who need it most. Over time, the perspective of this field has broadened and evolved. What began as medical geography, with a primary focus on the spatial dimensions of disease and its treatment, has gradually repositioned itself within the wider realm of social geography. This shift reflects a move away from a purely medical model, which sees health as simply the absence of illness, toward a more holistic social model. This newer approach, often called health geography, advocates for a redefinition of health that encompasses the promotion of general well-being. It recognizes that health is not just about preventing and treating sickness, but about creating environments where people can thrive. It is an interdisciplinary view that sees the deep connection between people and their surroundings as the foundation of a healthy society. Today, the tools available to health geographers are vastly more powerful than the hand-drawn maps of the past. Modern practitioners use sophisticated spatial analysis tools like Geographic Information Systems, or GIS, to map and understand the landscape of health. These digital systems can layer vast amounts of data, revealing complex patterns that would otherwise remain hidden. GIS can show not only where an outbreak of disease is located, but can also be used to predict the potential size and path of its spread. As individuals interact and migrate, they carry diseases with them, and these technologies allow researchers to model and visualize this dispersion across communities and across wider spaces. In essence, today's health geographers are continuing the work of pioneers like John Snow, but with a digital toolkit that offers unprecedented insight, helping us to see, understand, and improve the intricate and undeniable link between our health and the world we call home. Thanks for watching. Like, subscribe, and tell me your thoughts or next video ideas in the comments below.